As we've already talked about the different modes of the treatments that can be devised in these particular patients who are suffering from the psychological ailments, and mostly as a psychiatrist or as a practicing clinician, you try to treat these patients with the psychotherapies that are devised, ranging from the cognitive therapies or it can be the behavioral therapies, depending upon the classical conditioning or depending upon the operant conditioning. Then we also devise some sort of family therapies that are being carried out, in which you take a collateral history and then you also involve these families along with this thinking therapy or this talk out therapies that you're devising for the patient as well over here. And then we have another range or the modes of therapy which is known as the group therapies that are sometimes carried out for individuals who cannot afford the separate or the individual counseling sessions in these particular cases. So for those patients, a lot of group discussions or the group sections are carried out, and they basically provide a catharsis or a talk out phenomena to these patients as well to perform their day-to-day work or their lifestyle in their particular manner. So basically, when the outcomes are not quite promising in these individuals, even after the psychotherapies have been carried out, what you basically resort to is the pharmacotherapies in these individuals, and sometimes these pharmacotherapies are then coupled with this particular kind of psychotherapies or the cognitive behavioral therapies that you're carrying out. Now, there's another mode of treatment which is basically ranging from the electroconvulsive therapies or the electric shock therapies that are applied to a lot of patients, and they are quite promising in patients who are suffering from depressive episodes, from the bipolar affective disorders, the schizophrenias. So the psychotic disorders or the psychotic problems, all of these disorders can be catered to when you are dealing with these patients of the electroconvulsive therapies in these cases. So this is how you basically go about and treat these patients of the electroconvulsive therapies. And then you have these patients of the psychosurgeries. A lot of different ailments can be treated through these psychosurgeries as well. And then we have the exposure therapies that are being carried out. So what do you mean by basically the exposure therapies? As we've already discussed the different aspects of the cognitive behavioral therapies and the behavioral therapies, particularly in which you have the classical conditioning and you have the operant conditioning. There were two phenomena that we've already discussed. One was the extinction phenomena and the other was the flooding phenomena. Now, usually this flooding phenomena is devised for the exposure therapies, in which there is a virtual reality created for the patient. And for example, if he has a hierarchy of fear for the rabbits or for a particular kind of spiders or snakes, if he has phobias related to that, he is going to basically see images repetitively for that particular kind of animal, or for heights, even the agoraphobias, if he's suffering from that. So all of these can be treated through the virtual reality phenomena, and these treatments are basically nowadays used, and they're quite commonly used in these aspects. So these are known as the exposure therapy, and the technique is basically based upon the flooding phenomena that is observed in these individuals. Then the psychosurgeries that are quite common these days, and usually when we talk about the psychosurgeries, it is usually the lobotomy that is carried out in a lot of individuals. And there are a lot of side effects also related when you're carrying out these lobotomy procedures. So one has to be very careful, and one has to basically weigh the risk versus the benefit ratio if you're carrying out an intervention that is quite invasive in its characteristic. For example, these surgeries, if they're going to be carried out for the psychological ailments, you have to basically weigh the risk versus the benefit ratio, whether you're going to carry out this lobotomy or not, whether it is going to be beneficial in this particular patient or not. This is again quite a discussion that has to be carried out. It cannot be performed by a single doctor. Obviously, you need a medical board or a board of doctors that basically decide whether the lobotomy has to be carried out in a particular patient or not. So this is basically how you carry out these different kinds of psychological treatments, ranging from the ECTs, the psychosurgeries, and then we have the exposure therapies depending upon the problem that the patient is suffering from, and what are the outcomes or the prognosis depending upon the evidence-based therapies that have been carried out, and they have their charts and outcomes and the prognosis, and we have the evidence already recorded for them whether this therapy is beneficial in this particular kind of case or not. So this is basically how you go about and treat these patients. Now, how do you go about and see these culture and the psychotherapies in these particular kind of patients? This is again very important. Culture has its most important effects on these individuals. Cultures, ethnic groups, or genders of the therapist and the client sometimes differ. So usually, if you are the therapist, you can show a particular kind of a bias towards a statement that the client is making. So maybe in his or her religion or in his or her cultural aspects, it's a normal way to define or to express things in that particular kind of way. So these cultural aspects have to be considered when you're working as a therapist and you are performing these counseling sessions for this particular kind of case. Misunderstandings or misinterpretations by the therapist, they can again affect the outcomes or the prognosis of a particular kind of a treatment that is being carried out in that particular patient. 4 barriers to effective psychotherapy are the culture-bound values, then we have the class-bound values. If the therapist is from a high class or the high socioeconomic class and the client is from a low socioeconomic class, or it can be the other way around. It can be that the therapist belongs to a lower middle socioeconomic class and the client is from a higher upper class. So it's again going to affect the outcomes, or it's going to affect the interpretations of the therapist. The language is a very strong barrier. So having the particular language, being fluent in the particular language, because it is going to offer the communication skills to hinder. The non-verbal communication or the body language is again very important when you're working as a therapist or a counselor. Now we have the cybertherapies on the other hand, the psychotherapy that is offered on the internet. So basically it has its advantages and it has its disadvantages. Also called as the online internet or the web therapies or the counseling sessions. The advantages of the anonymity and therapy for people who cannot otherwise get to the therapist. So this is one of the advantages. If the patient cannot go out and reach the therapist out there in his or her own community, he or she can just reach the internet, and through that web therapies or the counseling sessions he or she can be treated. So the anonymity over here is one of the biggest advantage that is usually carried out, as psychotherapies or the counseling sessions are regarded as taboos in a lot of societies and cultures. So this cyber therapy is one of the newer inventions that are being carried out in a lot of patients in a lot of countries. Then we have the psychopharmacologies, the use of drugs to control or relieve the symptoms of psychological disorders. The antipsychotic drugs are sometimes devised, and then we have the anti-anxiety drugs. Typically, the minor tranquilizers are given in these cases. Now, what are the different sorts of the psychopharmacologies that are being devised in these cases? This is the general classification of the drugs that are being used for this purpose. We have the typical antipsychotics. The treatment areas are usually the positive symptoms such as delusions or hallucinations over here, and then we have the side effects that are ranging from the motor problems, and then we have the tardive dyskinesias seen in these individuals. The examples are chlorpromazine, droperidol, and haloperidol. Then we have another group known as the atypical antipsychotics. So the treatment areas over here are the positive and some negative symptoms of psychosis in these individuals. The side effects are fewer than typical antipsychotics. Clozapine may cause the serious blood disorders over here. The examples are risperidone, clozapine, and aripiprazole. Then we have another group known as the anti-anxiety or the minor tranquilizers. Symptoms of anxiety and phobic reactions are observed. The slight sedative effect potential for the physical dependence. Alprazolam, lorazepam, and diazepam are one of the newer drugs observed. Then we have the anti-manic drugs. The manic behavior is observed in these individuals, potential for the toxic buildup. And then we have the examples of lithium, anticonvulsant drugs in these kind of group disorders, that is the anti-manic drugs. Then we have the antidepressants or the MAO inhibitors. They are usually used for the depression, the weight gain, constipation, dry mouth, dizziness, headache, drowsiness, insomnia, and some sexual arousal disorders are associated with these kind of drugs. The examples are iproniazid, isocarboxazid, phenelzine sulfite, and we have the transcyclopramine sulfate. We have another group known as the antidepressant tricyclic or the tricyclic antidepressants used for depression. The side effects include the skin rashes, blood vision, lowered blood pressure, weight loss. The examples are imipramine, desimipramine, amitriptyline, and doxepin. Then we have the antidepressants known as the SSRIs, serotonin reuptake inhibitors used for depression. Side effects are nausea, nervousness, insomnia, diarrhea, rash, agitation. Some sexual arousal problems are also associated. The examples are fluoxetine, sertraline, and paroxetine. So these are the different sorts of the pharmacological drugs that are being used over here. So we discussed over here the different miscellaneous treatments that can be devised for the treatment of the psychological ailments. That is the end of this section. Thank you for watching sqadia.com.